Welcome to Medical Confessions.
Your remedy for serious medicine. I'm Jen.
I'm April.
And I'm Scott. Today we're going to be talking about Alzheimer's, what causes it, and a funny little test you can do that might predict that you have it, but maybe not also. Having to do with peanut butter.
Yeah.
Obviously.
I was going to say that, Alzheimer's is one of those things that I think just in general people tend to throw out just kind of effortlessly in a lot of comedic type things, or they reference it, but it's actually kind of pretty sad.
Yeah, I think it's sad, but at the same time, it's funny when you see people that are just a little bit off mentally, but not quite that. I mean, that full end stage Alzheimer's where they can't swallow and eat, that's really sad.
Right.
But in the beginning, when it's just
a little
slight
off.
Memory problems, it's kind of funny.
Well, and I think we kind of just, we'll connect that with just aging in general. And I know even as a teenager, I started picking on my parents about being old, which they were younger than I am now. So that's scary. But, I think we just, that's the Alzheimer's kicking in. We make light of it all the time. But I think when people are actually affected, and more importantly, their families are, it's pretty sad. And I don't think we, in general, the population has a very good idea of what exactly is Alzheimer's. We kind of interchangeably use it with dementia, which is a version of dementia, correct?
It's the number one type of dementia.
Yeah.
Yeah.
And
Isn't
that's
it
what I had to
80%?
do.
It's a huge percentage, I don't know exact.
It's 50 to 70% of Alzheimer's falls under the dementia.
I just said 60 to 80.
Wow.
Let's go.
I want to see the arm wrestle.
50 to 80, somewhere in there. But 70. A huge part of it.
Yeah. And before, I didn't even realize, I would just say, I would interchange, like you said, dementia and Alzheimer's, but it is different, syndrome versus disease.
Yeah. Well, and it's, so...
I love it when Scott thinks we're full of crap, because he stops, looks up to the air, and then is
how can I explain this in the way that doesn't make you sound like a dumbass?
Yeah. Basically, yes. That's what he does.
My facial expressions give me away every
Stop
time.
looking up. That is the dead giveaway that you're you're an idiot. But anyways.
I didn't realize
but you're sweet, so we'll carry on.
I didn't even realize I was looking up.
You do.
Oh,
dang it.
I'm
going to have to talk to you
Don't
this
ever
now.
play poker with us.
Yeah, ever.
This is why I lose all the time at the poker table. Dang it.
So
have you ever played poker, though, and tried to, not give a tell?
I don't play card games. And I don't I understand poker, but I just couldn't play it.
Well, I like poker just because it's the only game in the casino that they don't have the advantage. Everybody's kind of on the same playing field, so I play. But then when I have a really good hand and I'm trying not to show it, I feel like my veins are coming out of my neck because my heart rate is jacked. And I'm please don't know I have the good hand. And I just feel like they're watching my carotids just.
And I think I could do the whole psych somebody out, but I don't like the pressure of it wouldn't be fun for me.
It
would just make me angry, I think.
It's when we were little and playing Old Maid, my brother would always put the Old Maid higher than all the other cards, hoping you'd pick that one. I'm not saying I have it, but pick this one.
And I'm just not a good board game person anyway. Well, just not cards, anything. I have been known to throw a sorry game or two.
You get angry.
Oh yeah, in my family, my kids to this day will be
you are competitive.
Well, and the one time I was really Clue. I love Clue. And I think that I just mentally the idea behind it, and I thought I was pretty good at it, and I am, but my family accuses me of cheating. One time in my mind and by reading everybody else, I came up with the whole scenario, called it early, ended the whole game, and they were you cheated. I'm I didn't though. I would admit.
Just guess.
Yeah, and so now I'm just I'm done.
You're a cheater.
The board games are locked up. The family puzzles are nothing. That's what we're up to.
Mom goes all Hulk every time she plays a board game. Let's not do that.
All right, back up. Maybe I have Alzheimer's. Isn't that a symptom of Alzheimer's?
Getting all angry and emotional problems?
Yeah,
you got stage 1.
That's right. That's right. Yeah. So what is Alzheimer's, Scott?
Alzheimer's, specifically, it is a diagnosis. It is a type of dementia. It's the number one type of dementia. But specifically to distinguish it from other disease processes, there are two things that they can see inside your brain. One is called beta amyloids, and the other one is neurofibrillary tangles is what they call it. And I don't think I'm pronouncing that right, but it's a lot of syllables, so
Right.
I gave it my best guess. So actually, when it was first discovered in 1907, the doc Alois Alzheimer's.
It's his last name?
It is his last name.
Of course.
That's how that works in
Yeah.
medicine. But at the same time, technology just came around to where there are types of cell staining you could do and look through a microscope and see stuff. And so he did that. And one of his patients that he observed for a while having this early onset Alzheimer's, and he watched her decline, he looked at her brain afterwards and found, he called it abnormal neurofibrils. We call them neurofibrillary tangles now. And then he said this weird unknown substance between the neurons that we now know is a beta amyloid.
Like a plaque.
It is a plaque. So amyloids are basically proteins, amino acid sequences that aren't they're just sections of amino acid sequences. Normally in your body, your proteins form, and these amyloids are just a natural byproduct of that. The type causing Alzheimer's is actually a beta amyloid, and there's a specific gene, which is your amyloid precursor protein. We'll call it APP, and that specific protein creates a beta amyloid, and the gene that creates that is also called the same thing, APP gene. So, and then there's some other genes involved, actually 2 others that they can test for. Those 2, I've forgotten the name. Presenilin 1 and 2. And so the presenilin 1 and 2 and the APP gene are the 3 genes they can say that will affect Alzheimer's. And Alzheimer's is a combination of beta amyloids sitting between your neurons in your brain, not allowing the neurons to talk to each other. And then inside your cells, you have these basically that's microtubules inside your brain or inside your cells that allow nutrients and other substances to be transmitted throughout the inside of that cell. And those tubules are made out of a tau protein, tau.
Oh, I did see that. Yeah.
And so when that misforms, that microtubule will collapse and now not allow the nutrients inside the cell to get around. And the end result of both of those things is going to be cell death, brain death, or brain cell death, and eventually, if that spreads across your brain, you die of Alzheimer's. So that's Alzheimer's.
Right. And it could progress differently depending on the person, or...
It can. So there's early onset, which is very rare. So
and is it like 40s and 50s a lot of times when that comes up?
So early onset. Later on, normally Alzheimer's is after the age of 60, generally speaking, but you can get the early onset type. So, I mean, at the end of the day, the problem is amyloids and these fibrillary tangles. Whenever that presents, that will present itself.
Right. And they don't know who's predisposed, if it's genetic. I mean, is there other precursors? Or there?
Well, so those are the 2. No one knows exactly. I mean, there's kind of some controversy between, is it the neurofibrillary tangles or is it the beta amyloids causing it? Both are present in Alzheimer's. And actually the pathology, there's 7 stages of Alzheimer's. The pathology between stage 1 and 6 is based on those neurofibrillary tangles inside your brain. In stage 1 and 2, they can see it in star-shaped neurons. Stage 3, it kind of is in a lot more neurons and starts to involve like your hippocampus. And then stage 4 or stage 5 and 6, it's like all over the place. There was a study done in 2015 that was pretty cool in that we've heard of our lymphatic system gets rid of all of the bad stuff in your body. Well, they call it now the glymphatic system. And when you're sleeping, actually the space between your neurons increases and your body's able to get rid of more of those beta amyloids when you're sleeping. Thus, a risk factor for Alzheimer's is poor sleep habits.
Oh great. Ruined. We're all ruined. But actually, that's actually super interesting to me because my grandmother had Alzheimer's, and as does some of her children who are now in their later stages in life, we'll say 60s, 70s, 80s. And I remember as a young kid, and I'm going to say elementary age, we went to her house for like Thanksgiving, and huge family. And I remember when we were there, we hadn't seen her in quite some time, and she was cooking a meal and served tater tots. for Thanksgiving. And that's kind of like what it was, April. It was like she comes out with this big tray of tater tots and sets it on the table, and we were all like, oh.
Which would be amazing. I love tater tots.
Well, and nobody really argued it, because this was, like 30 plus years ago, and we were all like, yay,
Yay,
and so we did tater tots
for dinner.
But then very soon, I would say, within a year, there was a lot of other symptoms, and it turns out I think my grandfather was just taking care of her and hiding a lot of it from the kids. But the reason I connect this to what you just said is my grandmother had tons of children and probably never slept. Like, my mom's sibling base is giant, and you hear stories about, and over many, many years, like all of just constant kids keeping her awake, like probably a detriment to her. And she passed ultimately from Alzheimer's. So I'm just wondering, like, the kids literally killed grandma. They kept her up her whole adult life, and probably her disease progressed because of it.
Well, most likely it's a gene problem, but yeah, it certainly didn't help that you didn't get good sleep to help get rid of it.
Well, and it is a gene problem because now she has several children, some of my mom's siblings that have also presented, and my mom's kind of watching it happen around her. And as a family, we're interested because I told you before, I've done the 23andMe, and so I was really curious because there's that later stage Alzheimer's, the variant detected or not detected. And so I did it myself, and I don't have the variant, but I was like really wanting my mom to do it because I'm like, well, Mom, you gonna serve us tater tots next year or the year after? Like, let's. And you
I
hate
really
to,
like tater tots.
Right? Well, and I hate to make fun of it. That's kind of it is a real issue. It's a concern for our family for that reason.
Well, and so the genes that they're testing for, those three we just talked about, there's actually the APP gene. So it's a mutation of that gene that's causing this beta amyloid problem, most likely. There's a same mutation of that same gene found in Icelandic people that actually protect you from Alzheimer's. It decreases your body's ability to create these A and B amyloids.
Yeah.
And so if you don't create them, well, then they can't, create Alzheimer's. So they call it protective. They didn't actually give that one a name. It's they've named it A673T. Okay,
That's easy.
Some doctor needs to throw their name on that because that one's too hard.
Yeah.
Too many letters and
It'd be
numbers.
cool if somebody's last name was something simple like Bob.
Well, and you want...
I've got the Bob's disease.
Then you could just say it backwards and you'll be fine. You want to hear a funny story how they found the gene? Which I think is interesting anyway, because, while Down syndrome is not funny, it can be funny, and they are the source of so many hilarious memes that I laugh at Down syndrome people, but I do have respect for them as well. But in late-stage Down syndrome patients, almost all of them have these Alzheimer's symptoms, and almost all of them have increased amount of these beta amyloids everywhere.
Oh.
So everybody kind of has been aware for a long time that Down syndrome is an extra copy of your 21st chromosome.
Right.
And so when they saw that correlation in the 80s, they were like, well, shoot, if all of these Down syndrome people in the late stages have this Alzheimer's, is that the chromosome where it's at? So they started looking, and sure enough, they found the APP gene on the 21st chromosome. So that's exciting.
Huh.
So Down syndrome, see? I'm about to make fun of Down syndrome.
I just feel bad for you. Like, I'm like, you're going to get annihilated.
No.
No, well, and again, it comes back to, comedy. You can lighten it up, but it's a real malady. It's sad, but there are a lot of funny stories that you can connect to that. And it's just kind of how you look at it. How do you deal with it?
Well, the purpose of this podcast is to laugh at medicine, so we can make fun of Down syndrome people.
And Alzheimer's, actually, and like I said, there's, I think, it takes years for drugs to be developed and for them to be tested and be put out, but it sounds like there's 5 different drugs, and with family members that, I'm connected with, getting diagnosed, when early stages, and maybe trying to get some of these medications in your system or your daily routine to help slow the process. But I think a lot of times we just look at some of these symptoms and we just attribute it to aging, and so some people are probably slow progressing, and then some of them not. I heard a really funny story yesterday, actually, and it was just completely coincidental that we're doing this episode today, but one of my friends was telling me that their family's matriarch, their grandmother, was in a memory care unit and had begun to show symptoms of Alzheimer's and such, and so they would go to visit her, and every time they showed up, she had her bag packed. Like literally her suitcase
Oh,
was
yeah.
packed by the door. She knew they were coming on this day and it was ready. So when they showed up, she was like, no, I'm out of here. And so they would always kind of calm her down. But then one day they showed up, and in the middle of their conversation, she had been a smoker since the age of 13. So this is an elderly woman. I don't know how old she was, but I'm guessing 80s or so. And so she looked at the family and she goes, do I smoke? And they lied to her. And she had always been a smoker and was in this facility, would go outside to smoke. But she had Alzheimer's and it had progressed to the point where she forgot if she was a smoker. And so they said, no. Mm-mm. And she goes, oh. Well,
Did she ever smoke again?
She goes, oh, that is weird because I have a craving for cigarettes right now. I don't know what's going on with me. She never smoked again.
That's awesome.
They just never bought her more cigarettes, and she never smoked again.
It's a cure for smoking, Alzheimer's.
Yeah, apparently. Yeah. So anyway, I just thought that was funny. So sad for the family, sad to watch someone progress, but there are those moments like that where you can kind of just, well, it's for her own good. Lie to grandma, and I'm sure there's lots of other good stories out there. So
Well, and one of my favorite was someone I think we all know whose dad had Alzheimer's, and he was quite, what's the word, I guess a pretty promiscuous guy.
Oh, okay.
And he was at the Alzheimer's unit, sneaking into all the ladies' rooms, doing whatever it is that they do.
right.
And
We've had this discussion before about the highest rate of STDs is in nursing homes.
Well, and I just think it's awesome that when asked the facility, they're like, they're adults. If nobody's complaining, let it happen. And I thought, wow, the one good thing about Alzheimer's, you can just wander into people's rooms and say, oh, yeah, I'm your husband. Of course
Knowing
I
that
am.
family, though, there was probably no Alzheimer's present. This is just like an
This is a ploy.
opportunity for him. What? Where am I? Oh. So tell us about the peanut butter test.
Oh, so, well, in 2013, actually, it's a kind of a funny story.
We should explain our random
why
props
we
here
have
today. Just a
Jif
ruler.
and-
A ruler. And actually, we have a blindfold somewhere here in the studio.
I think it's on top.
Oh, I guess
Step
we
out of
would-
camera and grab that real briefly.
So, the reason this has come about, you're right that, right now, nobody can cure Alzheimer's. We can just know what it is and give medications to treat it.
Right.
And one of the treatments, like you said, is kind of helping with these beta amyloid problems.
Right.
And the sooner you start on that, the longer you can last. So early recognition is key.
Right. Well, and we have good friends whose one of their aging parents started to have symptoms, and it was kind of more lighthearted, forgetfulness and stuff. And then they went in and they did a couple-day testing, and then they were able to get on a whole course of medications. And it's interesting to me. I think it's like anything, hypertension or high cholesterol or any of these other things that could become more serious later on with other issues. It's just interesting because a lot of people are just like, no, I'm fine. And it's like, if you would just go in, we could probably slow the progress. We could make plans. We could address other issues that'll come up. But if you just want to ignore it, it could be pretty ugly.
Yeah. Well, and
Prevention.
it just brings on the symptoms sooner and, hastens your demise.
Yeah.
So the sooner you can diagnose it, the better. And so in 2015, there was a grad student who noticed that, the olfactory nerve is one of the first nerves affected by Alzheimer's.
Mm-hmm.
There's a section of your brain called your mesial temporal lobe, MESIAL. Pronounce that, I don't know.
Yeah.
Mesial. And that's usually the first.
No one can even hear you pronouncing anything over
The
the rooster
rooster.
noise today. Again, we apologize. Our location is not the best.
Yeah, but the lawnmower got shut off, so that's good.
True. That's good news.
And so the mesial temporal lobe is kind of, it's important for memory function and also for the processing of the sense of smell. So this grad student,
It's really bad today.
she was looking at cranial nerves and the fact that you can test different ways. You can test cranial nerves, one of them being your olfactory nerve. That's your first cranial nerve. And since she realized this is kind of the first sense to go, so why don't we try and design a test that will say, okay, if an early onset is that this section of your brain's being affected, let's make a test that tests that section only. And the smell test came up. Peanut butter specifically, because smell is a result of two nerves, your first cranial nerve and your fifth cranial nerve. The first one is your olfactory nerve. That's the one giving you that sense of smell. I think we did a Why You Goes Nose Blind episode once. And so that nerve directly affects your olfactory bulb. The other nerve that the trigeminal nerve is your fifth cranial nerve, and that one actually gives you like the sense of texture and of things that are toxic to you. And so combined, they give you that true sense of smell when both of those nerves are innervated. And there's not very many products out there that will specifically they call them a true odorant. And that there's not very many products that will only stimulate the olfactory nerve and not the trigeminal nerve as well. Peanut butter happens to be one of those things. So when she brought this up to her professor, he was like, yeah, we can do a nerve test if you want. If you can make it cheap and easy, let's do it. And she was like, oh, I use peanut butter. It's cheap, it's easy, let's try. And so what she did...
not to say that Jif isn't cheap and
No.
easy peanut butter.
But it is amazing peanut butter.
It is good peanut butter.
It is my favorite
I
type
prefer
of peanut
crunchy
butter.
though, personally.
Really?
Yeah, I like... Is there any combination there? Like the texture? You were just talking about that.
Maybe your trigeminal nerve's
Maybe.
getting with the crunchy.
Crunchy peanut butter.
Yeah.
I thought you meant the brand.
You guys are both
Oh,
weird.
is there a brand Chunky?
I don't know.
Just made that up.
I thought you said crunchy.
Crunchy. Yeah, like, isn't it
Yeah.
crunchy?
Crunchy peanut butter or...
Yeah.
Oh, thank God you got creamy.
Yeah.
I don't like crunchy.
I'm gonna make you eat
I like them
it.
both.
Yeah. Anyway.
I can't eat it.
No, I'm like, well,
I
what are you
love
gonna
Jif.
use to, with a ruler?
I'll eat with my fingers if you let me. Just lick it right out of
Just
the...
found the kinky side of Scott. Peanut butter.
My cousin ran away once, and when we found him, he had a bunch of peanut butter kids. That's what he was eating.
How long did he run away for?
I don't know.
Such an April story. He was missing for 6 months. It's
Who
fine.
cares? He was fine. Peanut butter and water. He's good.
His hair was glistening. It's the oils.
Just remember multiple peanut butter jars.
That's weird and sad. That's a long
And creepy.
time. Multiple peanut
Yeah.
butter jars.
Do what you gotta do to
Anyways.
get by. So what she did in this study was... So you've got the olfactory nerves, different nostrils. If you can sense the nerve or the smell out of your right nostril, the right side of your brain is actually the one processing that, and the left nostril, the left side of your brain is what's processing that. A little bit different than what we think of with strokes.
Yeah.
When it's your right side of weakness, it's your left
Right,
side.
right.
A little bit different. So what she did was basically tape up nostrils and take a bunch of peanut butter and slowly bring it to their nose. And what she found was there's about a 10 centimeter difference between how far from the nose that people with Alzheimer's could sense peanut butter versus the right side of their nostril, with the left side being usually affected first in Alzheimer's. And so that asymmetry between the ability to smell basically was saying, hey, if you give this peanut butter test to people, we can then get an early onset before big symptoms happen, that
Oh, wow.
this will
That's kinda
then
scary.
work.
And April's volunteered to do this today.
Well, so then there's, to throw some shade on that particular study, that was 2013. 2014, because in 2013 it was a big deal. I remember
Yeah.
bringing it up like, oh, we need to
I remember
focus
you
on
bringing
this.
it
This
up.
is
I'm like, I think
amazing.
you shoved peanut butter at me at work. Like, hey,
Check
Jen.
this out. Here, smell this.
Did you pass?
I think I did, yeah.
But in 2014, they tried to replicate that. They couldn't.
Really?
They didn't find the same things.
So she was shady.
Well, not necessarily, because then so in 2015 they did a review of the literature, then what's happening here, and they did find asymmetrical abilities to smell with people with dementias, and Alzheimer's being a main cause of dementia.
Yeah.
But dementias specifically, and then in 2015 they actually replicated that same asymmetry in another study for people with cognitive impairments, not just Alzheimer's.
Like head
So,
injuries or?
just cognitive impairments in general was what they were looking at. And so you're looking at all this body of evidence, and what it's kind of saying is that if you do have Alzheimer's, there is a chance that this will be able to detect it. But
Okay.
just because
It's not definitive then.
yeah, it's not definitive. It's like the flu-like symptoms, right? Just because you have symptoms of the flu doesn't mean you have the flu, and if you have the flu doesn't mean you'll all have the same symptoms, sort of thing.
Yeah. So it's something fun to do.
So mainly, it's kind of just something fun to do. I mean, everybody who's done these studies say the same thing. Sample size is too small. She only had 98 patients, and only 18 of them had true Alzheimer's.
Yeah.
Other studies, same thing. Small sample sizes. So it can't really be definitive, but there is this evidence that says, you know, if you have an asymmetry in smell, there could be something there.
Right.
So it's just a fun test to do.
Well, and plus,
And
it's like
certainly
for
not
video,
definitive.
we have April with a blindfold and earplugs up her nose.
And
Why not?
we get to smell some peanut butter.
And a ruler.
Okay.
So let's test if you have we need some sort of spoon unless we're fingering this.
Just use your finger.
Fingers. Okay, so here's 10 centimeter difference. That's the amount of difference for the perception of the smell. I can kind of smell.
She has 80s bangs right now.
Oh, yeah.
So do you want to do right nostril first or left nostril?
Sorry. I don't know yet. Now I'm paranoid about 80s.
I'm joking.
Shut
Just
up.
joking.
You didn't like the.
Where's the...
So here's one. Oh,
Oh.
Thanks.
I've
You
already.
only want one
What
side
is
or
that?
the other. She just rolled it.
I rolled it up for you.
That's not
I
it.
liked your reaction time, though. She's going to be a hard one to trick on anything. She's just like, done. My tactile function is omitted this being...
So let's put this away over here because I don't know about you, but I can smell peanut butter in the room
Right.
usually.
Yeah.
So
All
maybe
right.
I don't have Alzheimer's.
I
'cause
don't
can
know if
smell it
this
now.
is gonna... My nostril might be...
Oh, you really shoved that up there. I will not help you retrieve that later, April.
I'm just gonna...
Okay, so you just sit there. I'm gonna slowly bring this peanut butter to your face, and then when you say you can now smell it, I'll measure that. There.
Yep.
Holy bucket.
Holy
Stand by. We're about 24. Oh, is that a 30? No, that's centimeters. So we're about 30 centimeters
Okay, switch nostrils.
from your nose.
Okay.
That's covered up.
Oh, yeah.
She literally just did. She just scooted out.
Not rocket.
Oh.
Okay, give me the...
That was your right
Still
nostril?
squishy. Yeah.
It's okay. I
Well,
wash my hands.
No, that was my left.
Right?
I will laugh
This
so
is
hard
your
if that
left
gets
nostril.
flushed.
Okay, wait. Are you gonna do it?
Yeah.
Are you...
Whenever you say you're ready.
Okay, I'm ready.
Oh,
I
no.
can smell it now. Oh, that was a strong one. Whenever I
Okay, we
backed
need to
up.
try this again because
You were like 2 feet away the first time, and that was literally almost in your nostril. Just,
Yeah.
Well, I feel this one's plugged up now.
Well, there probably is that barrier too.
I mean,
If
this
someone's
is
got.
I
This
can
is-
smell it right now.
oh, this is definitely not a scientific test at all.
Well, and we have a small room. You know,
Yeah.
like I can't eat a Polish dog and not
Tell me
blow
when
you
you
guys
smell
out of
it.
this room with my burps.
Hold on. I gotta take another breath.
Okay.
I can smell it.
Oh, that was about the same.
Super scientific.
Yeah.
This is really
you're
legit.
good.
Scott's just gonna eat the peanut butter. It's Scott. You can take
Thanks
it
for that.
off.
Sorry.
That was useless.
It was
Yeah.
useless, but fun either way.
Yeah.
You actually concerned me in the beginning because I was like here before you said, "Oh, I smell it."
On
And
that
I'm like,
last one, and
The
it was
second one.
on the second
Yeah.
one. Yeah,
Yeah.
because it was like a shot of peanut butter up.
Yeah.
And I was like, ooh.
It was right there. But I'm with Scott though. As soon as you opened that,
Yeah, I
I
could
could
smell it.
smell it.
I
Even
can
though we
smell
put
it
the
now,
we have the
like,
lid
instant.
on it though.
Oh,
The
really?
lid's covered up. It's shut. So
Everywhere in the room
Tastes
now.
amazing.
all right, peanut butter is good. I can just
love
eat
peanut
spoonfuls
butter.
of it.
Yeah.
Peanut butter
Chocolate.
cookies.
Mhm.
Yeah.
So that was the peanut butter test in the 2013. It's not definitive, but it's certainly a thing. You know, maybe everybody says more studies need to be done on the specifics of that asymmetry in smell, but
Yeah.
it's a thing, and there's a good reasoning behind it.
Yeah. Well, this topic is so complex because so many things get associated with. So you're talking about deodorant or Sudoku will prevent it, or like there's all these things that it's
Yes.
like and so it's just one of these things like where do you even begin with it? We know it's a real thing. We know it's typically older people, but we have the early onset. We know it might be genes. We know you might be able to detect. There's so many things to consider with it that it's almost overwhelming. Where do
Well,
you begin?
And it is because we're talking about the brain. So depending on the portion of the brain affected, it's going to be a wide range of symptoms, right? It's like stroke. It almost could be any symptom, really, right? Depending on the area affected. Same thing here. What we do know is it's a progressive thing because we can see and actually watch in the microscopes the progression of those beta amyloids and the
I
progression.
love microscopes. They're so fun. They are. Like, I bought my kids one, and we collect stuff.
What do you look at?
Like not bat. I almost said bat wings. That would be horrible. Like flies, like things like that. Leaves.
Did any of the kids do the booger test?
No, we haven't tried that. But yeah, it's really incredible.
That would be like the first thing I'd want.
Yeah, ice was fun.
Oh.
Looking at like a little chunk of ice, and you can actually see like the air inside of it and stuff. So yeah.
And you can see the impurities in there.
Yeah.
So it's a good one. I always got the toy crap one.
Well, this one is a toy one, but it's like the Discovery Channel's version of it, so it's kind of a moderate one. But even I'm not a science or math person, but even like in school, like, junior high and high school, like I loved the microscope time. Like I loved looking at things underneath them. It's incredible.
But not telescope? Just
I've never tried a
microscope?
telescope. I probably would love that. Yeah, I probably would love it.
Super fun.
Yeah.
I think.
Yeah. Well, I'm sure you do.
What are you trying to say? I mean, I was going to make a voyeur
you eat
joke
peanut butter
there.
out of a jar with your fingers.
Yeah.
You probably find everything fun.
Peanut butter out of a jar with my fingers looking through a telescope at the neighbor down the road.
Oh,
Voyeur.
Weird. Got weird.
Dirty.
I actually like talking to my great grandma. She's 98 and she's got dementia, Alzheimer, whatever.
Yeah.
But I like talking to her because she'll forget who I am, and she'll ask me, "Who are you?"
Aww.
And I'll remind her. But to me, it's just fun because we'll start talking about one thing, and then she's off on a side story, and I'll just go with it and just keep talking with her. And then she brought up my grandfather who passed away. She was convinced, no, he's living with so-and-so, and I tried to correct her once, and this is the only time. I never did it again, because I tried to, no, he passed, remember, and tried to bring it back, and she's like, looking at me like I'm insane, and she's like, I think you're confused. Like, he lives so, and I'm like, yeah,
at least
I
she's
must
nice.
be confused.
Yeah.
She's nice though, because sometimes they'll get angry, or
I had my great grandpa also on the other side said, I hate you, because I was trying to make him eat. I was his caregiver for a little bit in his final days, and I was like, okay.
That's okay. And I think that's the hard part for people, is they're not recognizable anymore, like they change. And I always find it interesting that a lot of times they revert back to when they were younger, and so they'll go back to like maybe a child that they had that passed at a young age, or they'll revert back to these sad times or really traumatic events and stuff. And I always found that interesting. Or I know of one situation where maybe the husband was a little bit promiscuous, and so when her daughters would come visit, she would be like, "Oh, you're that hussy from down the street," but it was sad because it brought up a lot of family
turmoil,
skeletons, really. And they were like, "Oh, that was a real person in our lives." And I'm guessing, whether it was something that she just suspected or not, it was kind of like, ooh.
Well, am I the cruel one in thinking you told me the story about her quitting smoking?
Well, this was these were friends,
They're quitting smoking, and I'm like, what could we get them to do then? Like, don't you know you like to wear dresses? And then just see if they'll start wearing dresses,
Well, and the sad part is, I think that happens, but maliciously. Like, I think that's how people take, advantage of people. And, Grandma, you were going to pay for my college, remember? Those are the sad things that take place, and elder abuse, basically.
Well, I'm not talking about that.
You were going down that road, Scott.
No. I just wanted to laugh and see if Grandpa would wear a dress. That's really all.
I thought you meant Grandma. I'm like,
no, I meant Grandpa.
Grandpa.
Where's the fun in Grandma wearing the dress?
I don't know.
My grandpa actually died of Alzheimer's, and he was buried in Batman underwear because he really liked his Batman underwear.
Oh. That's okay.
Yeah, see, so I thought it would be funny. Let's see if Grandpa will wear a dress.
Yeah.
And that never happened.
No, but she got him in Batman underwear, so that's good.
He wanted to be in Batman underwear.
Did you tell him he wanted to be?
No, actually, it was my stepmom who did it. She's like, he loves his Batman underwear. Let's bury him in the Batman underwear. So we did.
Oh, well, so now we know what Alzheimer's is. Normally we write up molecules on the board. I was pretty stoked about this one because I read about a study where they found a molecule that
helps with beta amyloids.
Yes, absolutely. In rats, correct?
Well, so far in rats, and they found it by actually coming up with a diabetes drug. and then they just ran.
I love that you are so like pro science and studies, and half of this stuff comes up accidentally, like scientists not washing their hands, or I messed up, this is supposed to be for diabetes, but let's just throw it at Alzheimer's instead. And Scott is like, oh, science is everything. It's like the most incorrect, improper nonsense ever.
Well, no, it makes sense. Well, everything's chemistry, right? And so when they're like, oh, it affects these beta amyloids, I wonder if it'll work over here too, and then magically it does.
Magic.
Yeah, it's magic.
So
it's all
anyways,
chemistry.
Yes, absolutely. So we've talked about Alzheimer's, that it's a we'll call it a little root or offshoot of,
neurodegenerative disease,
but a root off of dementia.
Yeah, it's dementia is just like a class of diagnoses that basically is just talking about cognitive decline.
Yeah,
caused by tons of different other things.
Absolutely. So good.
I didn't look up and to the left then, just so you know.
You didn't. He wanted to,
I focused.
Though. He really brought it in. You're an idiot, but I'm looking forward.
That's not what I meant.
Well, if you like what you heard or saw today, check us out on YouTube or our podcast.
Or visit our website, medicalconfessions.com.